Professor Maria Cecilia, well, it's a long name. Maria Cecilia Perez, the last name is Aponte. Okay, so I got 4 names straight. And she is from the University of the Universidad Peruana de Ciencias Aplicadas. So we'll have her to introduce a little bit the issue of the interests of the REDAP and what exactly we are doing over here and having special personalities every now and then. Please, Cecilia.
Thank you, Humberto. Thank you, Humberto. Buenas noches a todos. Voy a hacer una breve introducción sobre la labor que venimos haciendo en la REDAP, la Red Peruana para Estudios del Asia-Pacífico. Es una red que está formada por las universidades, Universidad Nacional Mayor de San Marcos, Universidad Nacional de La Molina, Universidad Peruana Cayetano Heredia, la Universidad del Pacífico, la Universidad de Lima, ESAN, Universidad de Piura, Universidad Nacional de Tumbes, Universidad Nacional de Piura, la Academia Diplomática del Perú, la Universidad de Lima, la Pontificia Universidad Católica del Perú y la Universidad Nacional de Ingeniería y la Universidad Peruana de Ciencias Aplicadas, la UPC. Bueno, para mí es un honor estar con ustedes. Este trabajo, este esfuerzo que ha hecho la Universidad Peruana Cayetano Heredia para traer a la profesora Linxiu Zhang es parte de la labor que todas las universidades de la red hacemos, tratando de estrechar aún más la relación, la investigación en las diversas áreas que van desde la educación, la medicina, la sociología, etcétera, relacionadas entre las regiones del Asia y el Pacífico, ¿no? En nuestra labor ya tiene varios años. Actualmente estamos llevando a cabo el 5º concurso de investigación, que estamos muy orgullosos también porque han llegado investigaciones de diversos temas relacionados a la región, y este curso de investigación, junto con este tipo de conferencias, de trabajos conjuntos, de investigaciones conjuntas con las universidades del Asia, es lo que nos lleva a nosotros a seguir trabajando, a seguir investigando y a no solamente estrechar lazos entre ambas regiones, sino también en ver cómo mejoramos la calidad de vida de nuestra población, ¿no? Y en eso la conferencia que nos trae ahora la profesora Linxiu Zhang es muy interesante porque constituye el reto que se ha planteado China en el desarrollo de políticas para mejorar los temas de salud. Sin más, muchas gracias y los dejo con la profesora Linxiu Zhang.
Good evening, everyone. So, whenever I stand here, I want to tell you a story because I never wanted to be a professor in university because I'm too short. Whenever I'm in the podium, so I have to, raise up or lower the kind of microphone. So really, it's seriously. Good evening, everyone. So, you heard the introduction about me, but for me, I think it's an honor and the opportunity to stand in front of here and taking this opportunity, and not only just talking about some of my work, but also what I want to say is really establish the interaction or linkage or contacts, So from there on, we probably could interact in the future, see what are the mutual interests, and we could collaborate in the future, because I understand in 20 minutes or half an hour, there's no way of addressing all the things that we are interested in, but just give you a glimpse of something that we're doing, and hopefully we come up with some ideas or brainstorm for future collaboration or kind of exchange. So I really thank Ines, where she was the one really, said you should come here to give a seminar, but the earlier on, I would thank my friend Maria Mercedes Tan, and she was the one who brought me to Peru, and then we all linked together. So hopefully we could have, more of these kind of opportunities. So I've been thinking, in the 20 or 25 minutes what I'm going to talk. I know lots of people are interested in what's happening in China, but what my plan is, I'm going to use a brief tone to flash a little bit about China's development trend. And then human capital challenges and healthcare, I would touch one aspect because we have lots of issues related to healthcare, HIV, infant nutrition and the public health policy, whether neglected kind of issues we have not been addressed. But one of the things that China has been launched a national program, that's I'm going to talk a little bit. So not the complete health kind of issues here. So and finally, I wanted to leave the time that we can discuss where we can move forward, whether there's anything we're interested in. So one thing I want to say is that China have been having, in the past 30 years, always 10% annual growth of GDP. So when we look at, year 2008, the GDP was 16 times of that, the 1978, where we started our economic reform. So when I introduced it to the US people, they said, wow, it took us about 100 years to get our GDP 10 times of before, and it took China only 20 years, so now it's 30 years. So that's a fact of the development. On the other hand, when you look at the development, development for us as economists, we always say it's transforming from rural to urban. So urbanization is a process, and transforming from agriculture to non-agriculture, that's another transformation. This is show that the overall increase of farm work by the rural people, it's increased, from nearly, neglected amount, like 4% in the early 80s, up to now it's 63 or 65%. This is a part of the transformation, economic development there. So we all know, whenever you go shopping or somehow, you always see things made in China. So this is why, because China hourly wage in the 90s was really at the bottom. I don't know how. Yes. Okay. It's almost at the bottom, 0.5 per hour. So when we look at other things, that's why China, when you see things are manufactured in China now. And this was, like South Korea in the 80s, they had their hourly wage was 0.75%, but now they're 13 somehow. What I'm going to take you to is that, South Korea have been through the process of growth and transformation. Wage growth is fast. So, and this is why they transformed from, labor-intensive manufacture also to the, high-tech and high-productivity and service-based, innovative-based economy. So what you see China today is that's where I come in with the challenges. So in China, for the last 20 years before the reform, since the beginning of the reform, our skilled and unskilled wages hadn't changed much. But now look at China. The red line is China. China's unskilled wage is rising fast. So the manufacturing wages, or those kind of, you could see the numbers sky shooting up. This is really the challenging part. It's good because we are getting rid of the kind of a sweat, dirty sweatshop kind of work. But on the other hand, it poses new challenges because when you see China needs to continuously grow, right? And China's labor forces are falling. So everybody saw me, asked me, how many children do you have? How many children are you allowed? China have a family planning policy. We could only allow to have one. So with the demographical changes, and China's incremental labor forces are falling. And then rising wages in the future is going to be an unavoidable trend. And obviously, the changing industrial structure is a must. So that's where China can meet the challenges. So we are estimating by year 2025 or 30, China's hourly wage could be $10 per hour, like South Korea when they were transforming. So this is a massive thing we see today or yesterday. Now it's changing. In the future, it's no longer to be the case. So what we want to expect is that the textile workers in the high-wage countries, they are made to go, where they need to know computers, they need to math, and they need to English, where they can operate. this is where, with high wages in China, will have to move itself up the industrial ladder. That's the case. But China's real challenge is whether we have quality labor forces, where that's a human capital. So what is the problem with the human capital in China? In the future, we know 35 or 40% of the new labor forces are coming from China rural areas. We're talking about 50 million children aged of those. So remember, those kids in the school are the tomorrow's labor forces. But the problem is that going to colleges from poor rural areas is only 10%. When I went to the college about 35 or 36 years ago, majority of the students were from countryside. And now you see very few. In the prominent university in Beijing, you don't see anybody from poor rural areas because there are a lot of issues related. So we say, whenever we talk, we're economists, we always worry about inequality. When we talk about income gaps between rich and poor, China is going to be worse because we're 5-to-1 or 4.5-to-1. Now look at the higher educational gap. It's 35-to-1. We can claim it's the biggest gap. But it's not only there. We only have 40% of junior high graduates in the poor rural areas going to academy high school. So that's the thing. That somehow we see, of course we know there are literally tens of millions of children in China today that are not learning skills that they are going to need for tomorrow. We saw earlier, that's where the challenge comes. So there's also a gap here. So why those kids don't go to high school? Too costly, and poor information because we don't have, and so competitive. They're not competitive enough because their school performance was lower than the people who are in the cities, in the other places, because they have better opportunities. This is one of the things we did. Among more than 70 countries, both developed and developing countries, look at China's high school tuition of the public school, $160 a year. Look at all the others, mostly are zero tuition to high school. 160 is more than a kind of annual per capita income of people from rural areas, poor rural areas. So our new research also found that the sources of problem begin even before the high school. They're going to high schools only, junior high schools, there are a lot of high dropouts because there are other opportunity costs. Because for the poor families, instead of sending kids to high school, they can send them to the job market. Apart from the tuition fee, they also can, earn about $200 a month. That's another opportunity cost that poor families have to face. So that's not only the tuitions we're talking about. So the worst case is we see a high dropout of middle school kids. This is the government is so worried about because we have a 9-year compulsory education, which just finished the junior high school. The junior high school, that's 9 years. But lots of kids are dropping out. Look at the grade 7 is the first year of junior high, and the third one, the 9th grade. So nearly 30 to 40% of them poor rural areas, the kids are dropping out from junior high school. That you can see. Maybe because there's a lot of attraction from low-end manufacturer labor kind of demand. But tomorrow's world is going to be different. So now they are winners. They can earn a job. But in 10 years' time, when the industrial structure is going to change, they're going to be losers forever because they're not going to catch up anymore. So that's where we see the challenges for education. Because why there's other problems. So the real sources would be too expensive, high dropout, but actually the poor quality of education is also poor facility teachers coming in the poor areas. That's also counterpart. That's where we're going to do. This is really the test by the World Bank. You see, the average, the team's test for the 4th graders kids. If you are performing well, your standard deviation is 0. If you are a year ahead, they can also give to the 5th graders, 6th graders. So 1 grade or higher, you get a 1 point, 1 point kind of percentage higher. So vice versa, you can get to the 3rd graders. Look at the rural and urban. 4th graders, they're nearly 2 years apart, which means that the rural kids are 2 years behind the urban kids in terms of school performance in primary school. So that's happened. So really, one of the other key, kind of problems in China is we talk about curriculum, teachers, and kind of textbooks, but there's one area they haven't addressed: the poor health. That's what I'm going to talk about because, no matter how good you are investing in hardware, infrastructure, teachers, if they're not well, they have health they're not going to absorb what you're going to offer. That's where we came at, because I was always talking to people, where's policy researchers? If government does something good, we prize them for doing it, but we're not challenging something. But if there's a gap, something that they are neglecting, which is important, that's where we're getting into. So for my past 4 or 5 years, I've been trying to bring in healthcare, nutrition, and education together. In the end, we want to produce good human capital, but we started entering from a health, aspects or nutrition aspect. This China, Minister of Education, mental health, never talk to each other in terms of kids' education. And now they're doing so. I'm going to show you in the way how to do it. For example, when we did, between 1998 and 2012, 2008 to 2012, we tested nearly 40,000 kids. We found, iron deficiency is really a kind of common problem there. So nearly 1/3 of the kids in poor rural areas are iron deficient. Imagine their brain doesn't function well because they don't have enough oxygen or blood circulation there. So that's why. So when we have a national estimation, about 20 million school-aged kids are anemic. Think about 35% of the labor forces are coming from rural areas, and think about this number. What's the magnitude for China? So that's something we worry. So of course, in health aspects, there's other problems where intestinal worms. Now in the city, we don't talk about it. But in the poor rural areas, because China had really good public health system in a planned economy, where every year kids deworm. So I was dewormed, use a candy type of deworming medicine. But now that kind of public policy, health, action is disappeared, because one of the arguments is China is rich enough. Everybody using flush toilet. Nobody, play with dirt or somehow. But when we went to the countryside, 40% of the rural kids in the poor areas still have intestinal worms. They're not, on the one hand, they're not eating enough nutrition. On the other hand, they're being eaten by those, worms. So how are you going to expect their health going to be good? So myopia, when I see here everybody, who needs glasses is wearing glasses. When you open schools, you see all the kids wearing glasses, but in the rural areas, no kids are wearing glasses. I've just learned that 12% of the kids between 10 and 12, they are, naturally, biologically, are nearsighted. But health, kind of eye care had never been into a health system in China. So for the poor kids, because we also tested, when they're nearsighted, they don't wear glasses, they don't perform well. Not only that, they have self-esteem, self-confidence are lower than others, because when they act, they're not really being able to compete with others. Those kids are the ones who are being left out behind. So we're having a public campaign. We're doing, RCT, randomized control trials to test it. If you give kids classes, they boost their self-esteem, they perform well, they perform, they go. We wanted to put this into kind of national healthcare portfolio, which is something we push. But the others, nutrition problems, the health and nutrition, we work with American, prominent nutrition specialists. And, oh, you intervene kids in primary school, it's already too late. You should start with infant. Our infant nutritional program, more than 40% of infants in rural areas are anemic. So that's even more fundamental problem than that. But nobody's addressing. They're addressing like, okay, you have a prenatal or post kind of pregnancy checkup. That's all. But they don't push for nutritional kind of insertion kind of thing. So those are things. So when we saw all those problems, when we said provide these results to policymakers, what their reaction is, Minister, why should we care? In the Ministry of Education, why should we care a health problem? That's the health system. When the ministry has we know they exist, but tell us how to solve this problem. That's where, that's where I'm going to lead to the second aspect of what we did, like the need for action research. That's we call social experiment. That's normally been, you are the health aspects, the experts in the medical sector, you do this kind of RCTs all the time. But for economists like us, we're excited. It's a new tool for us, social experiments. So, seeing is believing, and document the seriousness of the problem on education is not enough. We want to show the effect of the treatment on them. And then, experiment with different ways of treatment, what works, what doesn't work, how effective, what the cost. and you gain the policy traction. That's the end, ultimate goal, what we want. So that's where we formed the Rural Education Action Project. This is really between Stanford and Chinese Academy of Sciences, where we want, because traditionally we do survey work. We find the problem, we do regression, sophisticated models, and oh, there's a relation, we say determinants, but actually all of those are causality, rather than causal relation, correlates, rather than determinants. So now we said, okay, we need to take action. Once we find the problem, we try to address it. We have a hypothesis, this leads to that. And if we do this, we would end up with that. But who believes it? Government wouldn't really believe your theoretical approach, but you wanted action. So that's what we do. We do is that we're interested in the solutions to help bridging the human gap. Of course, cost-effective and scalable. That's the good thing, because we want to mimic the policy. If you're going to a village, you send 20 professors every month to do something. In the end, the results are fantastic. I doubt that can be scalable, because you don't have these human resources to go every month, 20 professors go or 20 extension people to go. That's not really something kind of policy kind of mimicking. So we work in two ways. We design it, implement new innovative ways, but we also partner with NGOs and government. When they want to initiate some programs, we say, okay, we advise you how to implement, and you carry out implementation. We do the impact evaluation. So because we're the impact evaluation, I was talking before we started, and then we have partners, about 70 or 80 partners from corporate philanthropy, not only from research, but from corporates. Right now, fundraising is difficult for everyone. So we're entering this new stage. We work with corporate philanthropy, like a CSR, Department of the Corporations. So we've been very lucky. We have support. So we have 3 areas of this education action project: health and nutrition education, and technology, human capital, and keeping kids in school. That's where we want conditional cash transfer somehow. But I just want to quickly go through what we do, how we do. For example, I say that anemia is a problem. So what can be done? So what we assume is that if we gave iron supplements, will it lead to less anemia? With lower anemia, leads to better school performance. So what we do is a social experiment. We do conduct baseline, and then we do experiment. Half of the schools kids gave vitamins, half don't. And then after a school year, we do the evaluation survey. Repeat exactly the same thing what we did in the baseline. So the first one we did in Shanxi, where you get treatment schools and the control schools, and then you wait until you see. Those are the impact. After 5 months, all the hemoglobins of the treatment schools went up. That's hemoglobin level, and all the anemia rates went down. But more interestingly, the school grade, standardized mass test score went up for the treatment schools, the treatment kids, but not the control. That's why we wrote the first policy brief to the government. See, if you only, gave 10 cents a day to a kid, you could reduce the school performance rather than building new schools and having unhealthy kids attending school. So that's one aspect we did. So we also tested many other things. Remember, we had kind of intestine worms, eyeglasses. Those are really very low cost effective solutions. Early childhood education, computer room plus, because in China investing a lot to the hardware computers, but they forget about software and teacher training. So what we do, we're complementing conditional cash transfer to keep the kids in school. We only gave about $200 a year. We could, at student post, we could reduce the dropout by 60%. Imagine the magnitudes of 60% with $200 a year. China can afford, I'm saying that. So, but you need to have something solution for them. So far we've conducted about, I was counted last night, 35 or 36 large scale experiments of these RCTs with different aspects there. Some intervention, some problem need our very persistent kind of retry again. Some just one go we could get a lot of things. Because sometimes you see, you're assuming parents would care about the children's kind of health, right? Nutrition. You said, okay, I tell you, my nutrition is not good. Anemia is a problem. You need to do it, and then nobody cares. So something needs to be done by a collective action, or other things could be done individually. So that's what we test different kind of measures in the end. So that's what I talk about, the kind of RCTs on my health, on the education aspect, but through entering the nutrition and health aspect. I'm going to go quickly for the healthcare of the rural people because that's one of the programs that China is running. So I don't need to hear everyone that the significance of the health. It's good for economic growth and labor supply, productivity and income, and the poverty reductions that everybody knows. But the fact in China was in the early 21st century, China, some of the part of the China, a lot of people could not afford medical care. Unlike in the collective time, everybody go to the barefoot doctor. I don't know how many people have heard of barefoot doctor in China. But, the 46% of the kids the farmers didn't seek medical care when they had to have to. And a lot of people died at home because they couldn't afford. So why did they couldn't afford the services? Because in China in the 60s, 70s, we had 90% of coverage of medical insurance. And in the year 2003, only 21%. On the other hand, decreased coverage of medical insurance where China, even fuel had, medical health cooperative medical system insurance at the state level, state-sponsored rural health insurance, that's even lower. On the other hand, increasing cost of medical care, that's the trend. I don't need to explain inpatient and outpatient, the trends that's increasing over time. And also government funding to the healthcare of the rural people reduced because they're hoping that they can do it by themselves. So we are entering the stage, when the World Bank reports it, China needs to have a radical reform in healthcare. That's where we started. And then government responded, okay, because the old barefoot doctor system really deteriorated and removed, we have a new cooperative health system. They piloted 2003, the main goal is overall coverage. So they wanted everyone should be enrolled. And then they can reduce the poverty by, they caused by catastrophic illness because that's you get into poverty. So one of the important ones is that reduce, provide financial protection for farmers who suffer from this catastrophic illness. So actually this program is publicly funded and publicly run, but with farmers' participation and also their own contribution as a premium. And reimbursements are only partial of what they should be covered. So for those who want the details, I can give it later. But financial responsibility is county-based. So each county, they initiate their own package there. So really the results. The coverage, China, almost 95% of the rural by year 2008. Now, I think it's 100%. That was the number we had earlier. So 100% of coverage by all the counties. And also participation rate, enrollment rate is high, which is good, poor and rich and all enrolled. So, but our interest is to look at the impact evaluation, like what are the impacts of that. We follow this. Because I talked about RCT earlier, but our traditional way of doing research, we carry survey work. So we've done for this one, we did 4 rounds of the survey in a nearly national representative sample of 5 provinces. For this, we're able to say that changes over time and before and after the policy implementation. What we found, there are good things about it, participation, everybody loved it, but we see the reimbursement rate are clearly regressive. The more you spend, the less you get reimbursed, this worries us because poor people cannot afford to pay. Majority of those are out-of-pocket payments. That's not good. So we summarized those, and then we knew the coverage is okay, but the reimbursement was not good for the poor people or somehow. And then, and only 10% of the medical expenditure for catastrophic illness were covered. So 90% were out of their own pocket. Simply, they don't have enough fund earlier to start with. So what we did, based on this, we wrote a policy brief to the government. We said, look, it's a good program, but you didn't have enough fund. Even 100% of the funds spent on that is not enough, so it's not covered. So what we said, you should increase the premium or increase the government topping up. It's 1/3 by individual, 1/3 by local government, 1/3 by the central government. For the poor areas, you should top it, and you have other emergency programs. So we wrote that, you see, that's something happening. The premium started to increase. That's something we wanted to see. But on the other hand, we found that, medical suppliers, like healthcare suppliers, also tapping this money. So they oversupply. So now the government is still kind of working on how to remove, how to cap kind of incentives where they sell the medicine, they sell the services for the benefit of the suppliers and a kind of healthcare supplies rather than the end beneficiaries. So that's somehow. So given that so much changes, we did the last round of survey this year. So we're analyzing data. Hopefully we can get a couple more policy recommendation to the central government. So to ending my kind of brief talk, linking research to policy, for the past 4 years, we have 11 policy briefs based on our study from my group only to the central government. And lots of them being put into action, which that's what we want to see. Because we wanted to produce academic journal papers because that's the lifeline for our as a professional. But on the other hand, we wanted to really the government take action, because whatever you do is only one time of thing. Only when the government chip in and they can replicate and they take off. And that's the way that one NGO, one research group, 10 NGO, 100 NGO cannot solve China's problem because it's so huge. It has to be government. So that's why we are really targeting. The one I told you about anemia and the malnutrition, Chinese government started a national program, national school nutrition program, 20 USD billion a year for school nutrition, which never happened in history. Nutrition program run by Minister for Education. So that's somehow we felt so happy there's something going on. So final words, I think I don't have much knowledge about Peru. But what I believe is that China and Peru both are developing countries. We both are being through a lot of transitions. So, and both are going through the process from growth to development. Only when growth, you like GDP, you like everything to go. But when you enter in the development stage, a lot of issues, inequality, poverty, and other kind of social problems are happening, and you have to address them. So I think, addressing development issues are more complicated and challenging. Right? So public goods and service provision and poverty and inequality. So we should have a lot, I think we should have a lot to share and to learn from each other. And I hope this can serve as the beginning of our kind of long-term exchange and potential collaboration research areas where common interest. I think I will end up my talk here. So this is my project website, I'm only talking about one aspect of my center because we have our business aspect, we have trade commodity aspect, we have also modeling aspects, so that can be explained later. Thank you very much.